Hi, everyone. Thanks for being here today for Fostering Belonging Through Accessible Healthcare Practices, a conversation with HealthStream and Waggoner Diagnostics. Creating an inclusive workplace begins with recognizing the needs of every individual by prioritizing accessibility and ensuring we offer every appropriate service to our healthcare workforce, including color vision testing and support for employees of all needs. Organizations can foster a sense of inclusivity. These efforts not only promote independence, but they also strengthen the overall health and well-being of the workforce, meaning safer patient outcomes. Supporting our innovation conversation today about an equitable work environment is TJ Waggoner. Thanks for being here, TJ. TJ is the CEO and co-founder of Waggoner Diagnostics. He specializes in color vision testing and employment, specifically in healthcare. Hi, TJ.
Hey, Caroline, thank you so much for having me. Very grateful to you and HealthStream. Thank you so much.
Thank you. So, inclusivity and color vision testing. Tell us why we should be prioritizing these tests when we think about fostering an inclusive work environment.
Yeah, fantastic question. Well, I think we would all agree in healthcare, the most important thing is really patient outcomes, right? Patient care. And to truly provide the best patient care possible, we should be testing every single individual that is a frontline worker, right? And the reason is because that way all of them are getting equal care, because those who do have color vision deficiencies can have obstacles. I believe they can do the job through coping mechanisms that we'll discuss in a little bit maybe. But really at the end of the day, we believe that an inclusive environment will test these individuals, let them know what they can and cannot do, and then hopefully provide those coping mechanisms to them, creating a safer environment for patients as well as the employees themselves. So that is one thing that I think is important. And again, the reason for that, when it comes to patients, we really do have incredible examples of things that we can't necessarily, it's more difficult for us to do as color vision deficients. I say us because I am a severely green deficient individual, also known as a DUTAN. And so I have a hard time with rashes, gross hematuria, potential. I personally have never looked at a stage 1 pressure ulcer, but I'm sure I'd have a hard time with that. So it's really looking at these things and understanding what obstacles I have and then creating those coping mechanisms. And then lastly, from an inclusivity, I mean, first of all, it's the right thing to do. Secondly, it's the legal thing to do. ADA, so people who are color vision deficient are covered and protected by ADA. So I think it's really important to take that in consideration to give them every opportunity and provide them access to those jobs so they can do it. And again, I think even with a deficiency, they're going to understand things that they have, and they're going to be able to help their patients through that experience that they've had growing up with color vision deficiencies. So hopefully that answers your questions.
It does. And you're really talking about independence. The intention, right, as a manager or a leader in the workplace is never to make an employee feel less than capable, no matter their circumstance. So when we talk about color deficiency, what strategies do you recommend for addressing that unique challenge faced by employees with that deficiency, particularly in roles that heavily rely on color perception?
Yeah, that's a great question. So, we have paper on a lot of the different things that nurses, doctors, phlebotomists go through that they will have difficulties with. I can tell you going into the lab, a LabCorp or a Quest Diagnostics or a hospital and seeing all the phlebotomy tubes to say, hey, pick the purple one would be not fun for me at all. And so, labeling things, not just using colors, right? That's a good one. What I recommend for nurses, frontline workers that are dealing with the patients is asking them, hey, have you seen any discolorations on your body you want me to check out, right? Things like that. And then for if there's any doubt ever, I know this would make me feel special as a patient, just hearing from the nurse or whoever's color vision saying, they don't need to know they're color vision deficient, but saying, hey, I'd love to get a second opinion. Do you mind if I go get somebody else? And then they go get another nurse and they do a body inspection, right? So it's things like this where, I mean, what patient has been like, no, I don't want a second opinion. No, I mean, we all want that. We all want to feel cared for. And this is a great way to do it. So first of all, you have those issues, get a second opinion. What else is there? Understanding what you can and cannot do as a color vision deficient, right? Saying, oh, all right, the one that I think about often in hospitals is when I'm walking down the rooms and I see about 10 to 20 lights, all different colors, telling you, and can you eat? Are they a fall risk? Are they this? I'll tell you right now, I can't tell you all the different colors and what they mean. Now, I didn't study it, but I couldn't even do it with my abilities in color vision, right? So it's just really having an understanding of what obstacles they may have and then starting to learn how to cope with those best. Um, yeah, and outside of that, fortunately, testing is so simple, right? As you're well aware, we're so fortunate to work with HealthStream and integrate directly with you. So this is part of the onboarding process. This is going to be part of annuals because there are acquired defects that affect 15% of the general population and can affect their job. So really, as you're onboarding them and getting them all their other things that they need to have accomplished before, it's a perfect thing to add into the library and content with HealthStream to really create the safest environment we can and be inclusive. So, yeah, that's my point of view, and I'm sticking to it, Caroline.
Thank you, TJ. It's always a pleasure talking with you. Love this really high level conversation about why this is important and how we marry inclusivity with education and training and color vision awareness, right? It kind of all is one together, and it's an overlooked piece. So I love the chance to talk with you more about it. So thank you for this wonderfully insightful conversation. For those watching, we hope you'll share this information with others at your organization as we all work together to foster a culture of inclusivity and belonging and improve care outcomes. Thanks for watching.